our next speaker is Miriam Allred and Evan Westensee. They are from Home Care Pulse, and they will be sharing their insights on how our co-ops can be more efficient and achieve long-term growth. So I welcome Miriam and Evan.
How many caregivers and clients do you guys have?
Thank you so much for the intro. Miriam, do we have you here as well?
Yes, can everyone hear me?
Yep, we can hear you.
Okay, very good. Well, thank you for this opportunity. We're very excited to meet with you guys today and to present this. We'll be talking about our metrics for success. And we've outlined 5 metrics today that every home care agency should be tracking if you're not already. So lots of really good data and information. If you're not familiar with Home Care Pulse, we do the benchmark study for the home care industry, and we're really big on data. So we're really excited for this opportunity today. So a lot of people know Home Care Pulse for different reasons. As I outlined before, they know us through our benchmark study, but we have other products and services that we actually offer. And some of that is highlighted here on the screen. So 3 main kind of offerings. The first is client and caregiver surveys to give you an idea of the pulse within your agency of what the sentiment is across the board. So that's more of internal feedback. We have Review Manager that helps agencies with online reviews, online reputation, in regards to external facing things such as Google reviews, Facebook reviews, review tracking, things like that. And then also we have online caregiver training. We've merged with In the Know caregiver training along with Home Care Institute recently. So we have those 3 offerings basically for our products and services. Again, to kind of hit on the survey, the word survey. A lot of people hear the word survey and they think, oh yeah, we did the survey with Home Care Pulse or whatnot. That refers to our benchmark study, which is just our annual publication of operational data. It's a one-time purchase. Essentially, you're purchasing our content that we've gathered, the data that we've gathered through all the agencies within home care. And then on the flip side, when you hear survey, we also do individual surveys. So we're actually calling over the phone to clients and caregivers to provide real-time feedback, again, to give you an idea of the sentiment within your individual agency and kind of what's going on there. So there's a little bit of a difference there, and we just wanted to highlight that so that we could clear that up.
All right, thanks, Evan. Can everyone hear me okay?
Yep, you sound great. Go ahead.
Okay, sounds good. Sorry. Great. Thanks, Evan, for that introduction. I just want to touch on the benchmarking study. Today, we're going to share a lot of data points that your agency should be tracking specifically. And most of you know Home Care Pulse through this national home care benchmarking study. And I just, want to put in a little bit of a plug that this study is live currently. It launched, in February 1st and will go through March 31st. This is a great opportunity for you to take time to kind of analyze where your business is at and participate in this national study so that you can then compare your agency to other agencies in your state, region, and nationally. This 2021 edition is the 12th publication that we'll be pushing out this year. And a lot of people are anxious to see, how the industry was really affected in 2020 by COVID-19. So we've got the link there to participate, but we'll also send it out shortly after this meeting today. Just briefly, what we're going to cover today are the top 5 metrics that your agency should be tracking, how to successfully track those for long-term growth, and then where to focus your attention to move your business forward. Today, Evan and I were talking, it's not the most exciting of presentations. It's pretty straightforward and cut and dry, but really important that you track these metrics. So if you don't have a pen and paper, I'd recommend grabbing one so you can take some really good notes during this presentation. Before we dive into those first 5 points, I want to just highlight the importance of data tracking. One of our near and dear friends in the industry, Stephen Tweed, many of you probably know him or have heard of him. He always talks about what gets measured, gets managed, and what gets rewarded gets repeated. We've found that agencies that clearly define their metrics and measure what's most important in their business will continue to push ahead of the competition. And as an industry, we're moving toward a more data-driven approach to make ourselves known and stand out in this continuum of care that we talk about often. We have, what I call sister industries, home health, hospice, really all of the long-term care options, and they are very data driven and are constantly tracking. And we, as the home care private duty space, need to kind of up our game and continue to track to stand out and make ourselves known in the continuum of care. So diving right into the first point, inquiry to admission ratio. I want to encourage some participation in the chat and also in the Q&A panel. So with each of these data points, we'd love to have you comment if you're tracking this or if you're not. I think it would just be interesting for everyone on this call today to know who's tracking it, who's not. So feel free to jump in the chat and let us know if you're currently tracking inquiry to admission ratio. So why is this so important? All of our marketing and referral efforts are filtered through this singular process. Tracking this can help you pinpoint where people are dropping off within that process. And what we've seen with the thousands of agencies that we work with is increasing this ratio typically results in increased future revenue. So it's pretty simple and straightforward. And on this next slide, I'll show you how to calculate that. Pretty straightforward. The number of clients admitted in that given time frame, typically that 12-month time frame, divided by the total number of people who have inquired about your services in that same time frame. Obviously, inquiries, assessments, and admissions are pretty straightforward, and most of you should know what that is and be tracking that. But in case you have questions or don't, we've got those definitions there on the slide. So hopefully some of you are chatting in, what if you're tracking this or if you're not. Also, if you have any experience tracking this and results it's derived in, feel free to chat that out as well. But that's the first data point that you should be tracking.
The second point here is going to be covering acquisition costs and by what source and what that's coming from. So we'll do that for the clients by referral source and caregivers by recruitment source. And really just wanted to cover this as it really does provide proof of which sources bring in the greatest ROI. We don't want money to be invested in areas that aren't going to give us a good ROI. So this is going to help us identify some of that and to budget and prioritize correctly and accordingly. So here's how we calculate the client acquisition cost by referral source. We'll take the total cost of marketing through a specific channel in the given time frame, and we'll divide that by the number of clients acquired from that source in that same time frame. And make sure to include the hours spent by your team in this calculation, along with really just the more specific we can get with these numbers, just with any mathematical equation, the more targeted we can be and the more accurate we can be with this calculation. For instance, it's good to know the client acquisition cost for referrals from medical professionals, but calculating it for different organizations or institutions where possible may even be more useful. So just things to think about there as we look at calculating the acquisition cost by referral source. And then we'll jump over to the caregiver acquisition cost. Very similar, total cost of advertising and hiring through a particular channel for the caregiver acquisitions. And then divided by the number of caregivers hired from that channel. So again, just correlating there with the total cost of advertising for that channel divided by number of caregivers hired through that channel. Pretty straightforward, but just make sure to factor in all associated costs with that, including the time spent by your team and any other variables that may have cost you in that process.
All right, next we've got turnover rates. A couple of you are commenting in the chat, how are you tracking this? Is it in a software or where can we be tracking this? That's a really good question. Every agency is different. Some of these metrics you can track right in your scheduling software. Some you can't, Some of us may be in Excel spreadsheets where we're mapping out some of our financials or tracking some of these things. Regardless, it's really important to be tracking. This point number 3, turnover rates. We hear a lot of buzz in the industry around caregiver turnover, but more than just caregiver turnover, it's really important to be tracking client turnover and also office staff turnover. Some of the reasons that this is so important is that it'll provide insights as to whether or not you're retaining your staff and your clients. It also can help you predict how many people you need to hire year over year, and it can also help you identify client churn and make predictive decisions moving forward. I just want to highlight the importance of office staff turnover. We can't understate this. We've found a lot of correlations between office staff turnover and caregiver turnover. And if your office staff is turning over, then most likely your caregiver turnover is also turning over, kind of in that same correlation. So really briefly, how to calculate these: client turnover, your number of clients who left in that last 12 months divided by the total number of active clients in that same 12 months. Very similar for caregiver turnover, your number of caregivers who left in a 12-month period over the total number of caregivers employed. Like I said, caregiver turnover is a pretty hot topic, and we've gotten a lot of buzz about what it'll look like, in 2021 based off the 2020 data. Caregiver turnover was at a maximum high back in, I kind of get confused, 2019. And then in 2020, it dropped down to 64. So it was at 82 and then went down to 64. And everyone's really anxious to see here in 2021 if it's going to stay around that 60%, or because of COVID, it may actually drop because the client demand is so high. And obviously it's been hard to recruit caregivers, but we've heard that retaining them has actually been slightly easier over the last 12 months. So it'll be interesting to see. Also, just briefly, office staff turnover, similar. Our number of office staff who left in a 12-month period over the total number of office staff employed. Like I mentioned, back in 2019, actually found that for every one office staff member that leaves, on average, 5 caregivers leave. We talk a lot about the cost of recruiting a new caregiver. It hovers right around $2,600 to recruit one new caregiver. And just thinking about, one office staff member leaves, what cost that's gonna, take on your business, but then also 5 caregivers, that adds up really quickly. So just tracking these to know where you're at with both client and caregiver and office staff turnover is really important. If you have any questions about these, feel free to drop them in the chat so we can address them at the end.
We wanted to take a dive as well and take a look at the average client lifetime value. And it's really important to track this if you're not currently. Just really helps you understand how much revenue each client is bringing in. Helps predict, how your business can grow through new clientele. It really just highlights the value of every client you have and kind of breaks it out in that regard. So how we calculate this is we take the annual revenue divided by the number of clients serviced times the annual client average length of service. So we take that number, we divide that by the number of clients serviced. So we'll give you a second here to kind of look at this and jot it down if you'd like. Really something to be thinking about if you're not currently, is the lifetime value. Really just has a direct impact on that bottom line and actual revenue. As we look at this. So again, pretty straightforward, but we'll give you a second here to jot it down and take a little bit more notes on this.
Mm-hmm. Yeah, thanks, Evan. Just want to say we have people asking questions in the chat. We don't have a lot of people saying whether or not they're tracking this. I think it would just be interesting all around for people. Maybe you aren't tracking it and you're a little bit nervous to respond or to share. But I think just for the sake of this meeting, I think it'd be really interesting just to hear, who's tracking and who's not, so we can get kind of a pulse on how everyone's doing. Before we go into the 5th, we just wanted to throw in a bonus metric here. it's hard to narrow it down to kind of the 5 most important data points to track in that benchmarking study that we mentioned earlier. We ask agencies for 60 specific metrics, and then we, take that and really actually pull out about 200 metrics in that study. So at Home Care Pulse, if you ask us, what are the 3 or 5 or 10 most important data points, it's hard to narrow it down because there's so many that can really give you the full picture of your business. But Evan and I, are trying to just narrow it down to 5. But we wanted to throw in this bonus one, that is sales per full-time employee. And when I say full-time employee, we're talking about office staff, not necessarily caregivers. It's really important to measure this to know and to be able to cut overhead costs and find out where you're losing profits or operating inefficiently. A lot of larger agencies are always wondering, when do I add a seat or when do I add an office staff? And if you're tracking this, then you'll be able to identify, at what point do you add an office staff member because of where your profits are at, and where it makes the most sense for your overall operations. So this is a really simple, straightforward one. The sum of your revenue divided by the sum of all full-time employees. And just reiterating that it's your office staff team or your full-time employees, not your caregivers.
Okay. Number 5 is something I talk about and deal with on a daily basis in my job. I really hold this close to my heart. Net Promoter Score. It's not home care specific, but Net Promoter Score is just essentially the overall experience that your clients and caregivers are having. It really just helps you know if they'd refer your business or not, whether that's a client or a caregiver. And the way we track this is using a scale of 1 to 10. We ask these in our surveys we do with clients and caregivers. So this is very much, NPS is very much a big part of Home Care Pulse's process in that surveying. To calculate Net Promoter Score and eNPS, or Employee Net Promoter Score, we are going to take the percent of our promoters, and we refer to promoters, you can see the scale there at the bottom, as either a 9 or a 10 out of 10. So that would be considered a promoter, and a detractor is going to be anyone who's going to give us a score of a 1 through a 6. And so we're going to take the percent of our promoters and subtract that from our percent of detractors, and that's going to give us our Net Promoter Score. So pretty simple calculation this time.
Yeah, feel free to drop any questions about NPS in the chat. We know it's maybe not as familiar as some of these other data points that we're talking about.
Absolutely. So just some reminders to kind of summarize things here. Really, like Miriam said as well, we had to pick just 5 to cover today. And so that's kind of what we've showed you thus far. But we're not here to say those are the only 5 you should track. But I think that should give a pretty good idea and at least be interesting on a few different levels. It's up to you guys to begin tracking or refining your data collection. Again, you guys know best, your neck of the woods better than anybody else. And so absolutely just wanted to provide some sort of parameter or some sort of kind of ideas for you to kick around. So take time as a team to review and refine your KPIs and your goals as an agency there, and then really just focus on meeting the needs of your clients and caregivers. I think when we talk about Home Care Pulse as a company, that truly is one of our core values, is just we want to provide better care for seniors and for pediatric clients, whoever your clientele is. We want to allow a higher quality of care. That's really the common denominator for Home Care Pulse. And by surveying and giving people a voice, it allows naturally the process of improvement. If you're doing something well, to continue doing that well and to make the caregivers feel good that they're doing something well, or really just full circle at the end of the day, meeting the needs of current clients and caregivers. So just wanted to highlight that and summarize that there.
Thanks, Evan. Like we mentioned earlier, along with this national study that we push out, It's a pretty extensive survey. And so over the years, a lot of people come to us and say, hey, we're tracking some of this, but not all of this. So what we've actually done along with this study, we've got a prep worksheet that we promote along with the survey so that you can review this prep worksheet, go through it, meet with your team, gather all of this data before you actually take the survey. So I've actually just chatted the link out to this prep worksheet. We've heard time and time again from organizations that it's a really good exercise for your business. Like I said, there's so many metrics that agencies are tracking typically in their scheduling software, but there's a few data points that we ask for that they may not be tracking, but should be able to calculate based off a number of other metrics. So we highly recommend that you download this prep worksheet, review it, find out what these metrics are and use it as an exercise for your executive team or anyone that would be involved in any of these metrics. So I've just chatted that out where you can download that. It's 8 pages. There's I think about 30 questions on here. In the study, there's both qualitative and quantitative data. And in this prep worksheet, it's mostly the qualitative, the quantitative data that we ask for so that you can prepare to take that in the study. I'd imagine a few of you on this call have taken it or have seen it or have gone through this process before. So feel free to comment what your experience has been like, either with this prep worksheet or even participating in the study.
All right, we're gonna wrap up today with a poll question. I believe I will most likely be the one to kind of continue any conversations. But we wanted to ask a question. Would you like to talk with one of our specialists or myself about how to integrate these metrics into your business? Very happy to do this. So we'll open up the poll question here. Really, if you have any questions top to bottom from our presentation today, we're happy to get on the call, whether that's relating to online reviews, strategy around retention, strategy around recruitment, how data can impact my agency. Really, I can help tie in some of the principles we've covered today and how that directly applies to some of those metrics relating to ROI and other revenue driving sorts of things. So happy to tie it all in and to make a connection if you didn't today, or if you just had any other further questions. Again, we're very happy to have conversations. Whether you're serious about starting with us or not, I think a conversation would be great. So we'll open up the poll here for a little bit longer. We've got some really good activity in the chat, so thank you everyone for your participation in that.
Yeah, we'll leave that poll open for a little bit longer. I'm just kind of scanning the chat. I don't have the Q&A bar pulled up. I don't know if you do, Evan, but just kind of looking through the chat, I'll address a couple of questions that are coming through. And as you have more, feel free to send them in. One question, the prep worksheet does not cost anything. With that link that I chatted out, you can hit that and download that prep worksheet, absolutely free. It's just a resource to help you benchmark your business, but also prepare to participate in the national study. Another question, the survey that's open right now in 2021 is collecting all of your data for 2020. So the 2021 publication that will come out in May is actually all of the aggregated and final results or data collected from 2020. So hopefully that clarifies that as well. A couple of people have chatted in, love the benchmarking study. It's just a great resource for your agency to benchmark. I also understand that ICA does kind of their own aggregated report. I'm not super familiar with that, but I'd only imagine that those two resources together could provide your agency a really good picture as, how you compare or doing inside of the ACA network, but also at a national level, where you compare to your region or to the industry as a whole. Evan, any questions that you're seeing come through that you want to speak to?
Yeah, there's just a comment. It's not a question. It's just please talk more about how most agencies are actually tracking these metrics in practice. I guess I talk to a lot of agencies on a daily basis across the United States, whether it's California, Florida, New York, Michigan, really across the board. And it really just depends on how we're getting the metrics that we're plugging into the equations we covered today. For most people, they just use their scheduling vendor or scheduling software. So like their ClearCare, and they pull reports from those as far as tracking turnover rates and things like that. It is fairly manual. I mean, obviously, there hasn't been any sort of software integration to where it automatically would just give you these numbers. But again, there's not too many different metrics, just a handful that we've covered today. But that's generally what I have seen in my experience, is just pulling from their scheduling vendors from the current data that they have. So I don't know if that was helpful, but that was just a comment from somebody.
Yeah.
Go ahead, Miriam. This is Leslie Mead, and I have some of the questions off the chat that I'm happy to ask you.
Yeah.
So one of them is, given that you speak to so many agencies, I'm curious what percentage of agencies do actually track these metrics? And can you speak to the correlation between tracking these metrics, these data points, and revenue? Where do agencies that track these metrics sit in terms of revenue brackets, overall financial success?
Yeah, that's a really great question. Like Evan mentioned, we work with agencies across the board. We work with agencies as small as 10 to 15 to 20 caregivers, but then we also work with agencies that have 1,000 or 2,000 caregivers. So our spectrum is really broad. And with the smaller agencies, we're encouraging them to start tracking and form those habits really early on. Whereas most of the larger agencies, they're tracking this and seeing their success and, kind of already have a process in place. In the benchmarking study, typically we have around 1,000 agencies participate. So, that kind of gives us a slight picture of, we have a really good group of agencies that are tracking this very specifically. But as far as a number, people throw out a lot of different numbers, how many agencies there are across the US, whether it's 30,000 or 50,000 private duty agencies. We don't know exactly how many are tracking, but like Evan mentioned, a lot of your scheduling software providers, ClearCare, AccessCare, AlayaCare, they all have a lot of reporting features where you can track this. So we recommend that you reach out to them if you're not using these reports regularly, reaching out to your CSM there and talking through some of these questions and asking them about these reporting features that are built into their system so that you can utilize that to track. Hopefully that kind of answered the question.
Here's another one. Also related to the annual survey, would love to hear why HCP decided not to track caregiver tenure anymore. We track this from our sector.
Yeah, I'm just looking, that's referring to the annual study. We do still track that. Yeah, I'm not sure why they're saying that we don't. But yeah, we do still track that in the annual study. We've pulled, if people are using our in-house surveys, we have pulled out some of the metrics inside of that platform, but inside of our study, we do still actively track caregiver tenure or caregiver turnover.
And then the last thing we have here is, could you say something about the qualitative aspects of your survey?
Yeah, good question. Like I mentioned, inside of the study, we ask about 60 questions, and that's ranging from about 6 categories. I don't know if I can name them off the top of my head, but sales and marketing, recruitment and retention, financials, operational. We ask a number of qualitative questions as well. Most of them are inside of the caregiver retention and recruitment section, and that's just kind of about the quality of training, the quality of service. They're pretty straightforward questions, but inside of each of those sections, there's a number of qualitative questions that we ask as well, just so that in the national study, we can speak to both, the quantitative, but also some of the qualitative as well, just to kind of keep a pulse on, the quality in general.
I think that's all the questions we have in the chat. If anyone has anything else, drop it in right away, because I think we are concluding this session. So let's see, just a second. Here's another one. Generally speaking, why is tenure important to track as well as turnover rates?
Evan, do you want to speak to that one?
Sure. Oh, sorry, I thought I was on mute. Okay. So why do we track tenure rates and turnover rates? Is that the question?
Yes.
It's a good question. And Miriam, if you want to add to this as well, I feel like they're pretty similar, if I'm not mistaken. And frankly, I don't want to like throw out a wrong answer per se. I think it's more of like an opinion of why we do this, I guess. But from my experience in working with agencies, turnover rate's a must, I think, across the board. And then tenure is just kind of almost like a cherry on top because it's so similar to a turnover rate. But I think also other metrics come into play when we talk about tenure. So how much a client is how much value does the average lifetime value of a client that we've talked about. And then when we look at tenure, there's a lot of variables that go into it. So I guess my short answer here, as I kind of ramble on, is just simply, it's so similar to the turnover rate.
36 de 4.
Turnover rate, but I don't know.
Sí, faltaría de pronto un poquito, pero sí salen. C4.
Sorry,
We need to mute, please.
No, si son 36 se puede de este, pero mira qué hay. O sea que cualquier cosa uno. Ajá. Sí, se puede.
Can we mute? Thank you. We have one other question, and that is who answers the qualitative question on caregivers, administrators or caregivers themselves?
Yeah, I can take that one. So the study is all completed by the administrator, by your executive team. So a lot of those qualitative answers will come from whether you're already tracking satisfaction. Some of you may be using our satisfaction surveys, but some of you may not. But it's all filled out by the administrative team or your executive team.
Okay, great. Great. Thank you so much. That was terrific. We really rely a lot on the Home Care Pulse survey every year. It's such a valuable tool, and I really appreciate you spending time with us this morning.